Hello, welcome. I'm Dr. Darren, family medicine physician, and today we're doing health education on topics that you want most. This video is on laboratory exams. I'm a huge fan of mathematics and problem solving, and I love objective data. So laboratory exams play a huge role in my medical practice. Labs can tell you a whole lot about your health, and they can play a huge role in screening for and diagnosing medical problems. So this is a really important topic that you need to know about. We're going to be covering my top 10 favorite labs that I order in my practice, and I'll explain why I order them and the role that they can play in managing your health. Now, if you like topics like this, be sure to subscribe and leave a comment down below letting me know what health topics you'd like covered in future videos. And if you have any questions, be sure to leave them in the comments and I'll answer all of them. Now, before we get started with labs, remember that these videos are for education purposes only. I cannot give personalized medical advice here. So if you're having a medical problem or if you think that you need to get some labs done, make sure that you go to see your doctor. Now, let's get started with laboratory exams. Number 10, testosterone. Checking testosterone can be a very useful laboratory test for many patients. It's a blood test, and the primary reason that we check testosterone is to look for testosterone deficiency, especially in men. Testosterone decreases on average by about 1% per year, starting at age 30, but this varies a lot from patient to patient. The classic symptoms of testosterone deficiency include issues in the bedroom, such as decreased libido, difficulty putting on muscle mass, even though they're doing lots of strength training, and generalized fatigue without an obvious cause. If someone does test positive for testosterone deficiency, this can be treated by beginning testosterone replacement therapy, or TRT. Other reasons that we might check testosterone would include if you have someone who is having difficulty conceiving, or if you have a trans patient. Checking testosterone levels can be very useful in trans medicine. Number 9, urine pregnancy test. Performing a test of the urine to see if someone is pregnant is a very, very useful laboratory test to perform, and this can be done for different reasons. A classic time to do this test is if you have a woman who is trying to get pregnant and her period is late. So we can do a urine pregnancy test to confirm whether or not she is pregnant. We also might do this test if someone is having symptoms, which could be from many things, including from being pregnant. For example, if you have a patient who is having abdominal pain, or she's feeling dizzy or lightheaded, or she's having menstrual symptoms, those might be because of pregnancy. So if somebody's having those symptoms and she is of reproductive age, good idea to check a urine pregnancy test. And finally, this test is useful to do if you're going to begin treatment for a medical problem, and this treatment could be harmful to a baby inside of the woman. There are many medicines that we prescribe for various problems, such as high blood pressure or headaches or to treat chronic pain, and many of those medicines can be harmful to a developing fetus. So if we're going to start one of those treatments, it's an important idea to do a urine pregnancy test if you're going to start treatment on a woman of reproductive age. So all things considered, doing a urine pregnancy test on a patient of reproductive age is never the wrong answer. Number 8, electrolytes. When we order a blood test to check electrolyte levels, we're checking the levels of specific elements in the blood, such as sodium, potassium, chloride, and bicarbonate. In particular, I find that checking sodium and potassium levels are very useful. These electrolytes are highly regulated by the kidneys. So if we take sodium, for example, if you are young and healthy and you have a high salt diet versus if you consume a low salt diet, in both cases, the kidneys will regulate your blood levels of sodium and keep them in a relatively narrow range, so you should be safe. On the other hand, there are some chronic problems or medicines that could throw the electrolyte levels out of whack. Some examples include if you suffer from high blood pressure, if you suffer from kidney disease, or if you're taking certain medicines which can affect the levels of electrolytes in your blood. So if any of those things apply to you, it's a good idea to have your electrolyte levels checked on a regular basis. Number 7, thyroid stimulating hormone, or TSH. TSH is a blood test, and this is used to screen for thyroid disease. TSH is produced by the pituitary gland, and when the level is abnormal, I typically check a T4, which is a different thyroid hormone that is produced by the thyroid gland itself. The reason why it's important to screen for thyroid disease by checking a TSH is because, unfortunately, thyroid disease is very common, especially in women, and the symptoms of thyroid disease can be quite broad. And in fact, you might not have any symptoms, but you're suffering from thyroid disease. The classic symptoms of hypothyroidism include feeling fatigued, gaining weight, feeling depressed, having hair loss, and feeling colder than others around you. By contrast, the classic symptoms of hyperthyroidism include also feeling fatigued, feeling anxious or having heart palpitations, losing weight, and feeling hotter than everyone else around you. It's important to be tested for thyroid disease if you're experiencing any of these symptoms. In addition, if you're not having any symptoms, but you have risk factors for thyroid disease, then it's still important to have your TSH checked at least once a year to screen for thyroid disease. Number 6, urinalysis. A urinalysis is done by collecting some urine and performing various laboratory tests on that urine. A urinalysis can have many clinical applications. It's a great way to test to see if somebody has a urinary tract infection, or a UTI, that is. And if there are signs in the urinalysis that someone might be having a UTI, that urine can be used for a urine culture, which is the classic way to confirm if somebody has a UTI. Urinalysis is also useful to see if somebody is dehydrated. If somebody's having symptoms like feeling lightheaded, blurry vision, or feeling dizzy, they might be dehydrated, and a urinalysis is a great way to confirm if they're dehydrated. In addition, a urinalysis is a great way to look for kidney disease, and this often shows up as having blood in the urine or having too much protein in the urine. All things considered, urinalysis is a very useful laboratory test that can be used to diagnose medical problems and also can be used as a screening exam. Number 5, AST and ALT. These are the most useful liver enzymes that we check. When these values are elevated, they suggest that there is inflammation in the liver. AST and ALT may be elevated because you're dehydrated, or because you're drinking too much alcohol, or you're suffering from fatty liver, or you have an infection of the liver, such as hepatitis, or you're suffering from liver failure, such as cirrhosis. When liver enzymes are elevated, it's a good idea to order follow-up tests to investigate the liver, such as additional labs that are more specific for the liver, and imaging of the liver, such as an ultrasound or a CT scan. The classic symptoms of a liver problem include having abdominal pain, vomiting, having diarrhea, or having yellowing of the skin, which we call jaundice. But you also may be suffering from a liver problem and you might not have any symptoms. Because of this, AST and ALT can be very useful laboratory exams to diagnose a liver problem or to screen a patient for a liver problem in someone who doesn't have any symptoms. Number 4, complete blood count, or CBC. A CBC is one of the most useful blood tests that we perform. A CBC measures the levels of various cells in the blood as well as cellular components, and these include the white blood cells, the hemoglobin, and the platelets. Abnormalities in white blood cells can happen for various reasons. They can be elevated if you're having an infection, for example. They can also be low if you're suffering from an immunodeficiency, such as HIV. Abnormalities in hemoglobin are also common. If your hemoglobin is low, that can be because of anemia, which is common. And if you have high levels of hemoglobin, this may be because of other chronic medical problems, such as hemochromatosis. If your platelets are low, this could be because of an autoimmune disease. If your platelets are high, this could be because you're dehydrated. Platelets, of course, play an important role in forming clots. There are serious medical problems, such as lymphoma and leukemia, which can cause extreme abnormalities in the results of a CBC. Because a CBC is so useful, it can play a crucial role in investigating why someone is having symptoms, and it can also be very useful as a screening exam. Number 3, creatinine. Creatinine is a waste product that is found in the blood, and we measure the blood levels of creatinine to tell us about the kidneys. It tells us how well the kidneys are functioning. The kidneys are easily one of the most important organs in the body, and when you're having problems with the kidneys, this can cause a variety of medical problems, and as a result, a variety of different symptoms. Therefore, checking blood levels of creatinine can be extremely useful if we suspect that somebody is suffering from kidney disease, or if somebody is having symptoms and we need to figure out why they're having those symptoms. And it can also be useful as a screening exam. Number 2, hemoglobin A1C. The hemoglobin A1C is a blood test, and this is the most important way that we test for diabetes. Diabetes is a serious medical problem, especially in a country like the United States. Diabetes can cause a variety of symptoms, such as blindness, kidney failure, vascular disease, nerve damage, and it greatly increases your risk of having a heart attack or a stroke. The scary thing about diabetes is that early on, there may not be any symptoms. So it's very important to check the hemoglobin A1C in most adults in order to screen for diabetes. Or if we suspect that somebody has diabetes, then checking the A1C is important to diagnose them with diabetes. And finally, the number 1 laboratory study that I use in my practice, lipid panel. The lipid panel is a blood test which checks the levels of various fats in the blood. And these include total cholesterol, LDL, HDL, and triglycerides. High cholesterol, or abnormal cholesterol, is one of the most common medical problems in adults. The way that we treat abnormal cholesterol is through eating healthy, exercising, and maintaining a healthy weight. In addition, we sometimes prescribe medicines for abnormal cholesterol, such as statin medicines. The reason we care about high cholesterol or abnormal cholesterol is that it greatly increases the risk of having a heart attack or a stroke, and obviously, these can kill you. Because of that, lipid panel is the number 1 most important laboratory test that I use in my practice. That's it for today. Thank you for watching. Be sure to subscribe and leave a comment down below letting me know what other topics you'd like covered in future videos and if you have any questions. Remember, these videos are for educational purposes only, so if you're having any symptoms or if you think you need to get some labs done, be sure to talk to your doctor. Bye-bye.